If the patient has developed any kind of tumor or any atresia of the bile ducts, or if there is any biliary calculi, or if there is any stone of the gallbladder called as Cholelithiasis, what happens is there is an obstruction in the flow of the bile juice. So we all know, the typical characteristics of an acute cholecystitis: fair, fat, flabby women developing pain immediately after eating a fatty food is a characteristic symptom of cholecystitis. When the lipid or the fatty material which is being ingested by the person as a result of eating, what happens is the moment the lipid materials enters the duodenum, there is a reflux. Via this reflux, what happens is, in order to digest this cholesterol and the lipid material, the bile gets extruded via these ducts and it enters the main pathway. Okay. So since there is an obstruction, the patient is having a kind of stones. What happens? There is an impediment or there is an obstruction to the flow of bile which results in the pain. We need to know whether the physician is placing a stent, so you can quote for the placement of stents in each of these ducts, or if it is a removal of stents, in that case you will have to code as removal of foreign body. Brushings can also be taken. Brushings of either of any of these parenchyma can also be taken. Same way, if the patient has developed biliary stones or biliary calculi, what happens is they can pass a stent and they can remove this calculi also. So with ICD-10 we have specific guidelines on the combination codes for this calculus, because when a patient has both the stones of gallbladder, it is called cholelithiasis. When there is a stone formation in the bile duct, it's called as choledocholithiasis. Okay, what is choledocholithiasis? Presence of calculi in the biliary duct.